Hello and welcome to 90 Seconds with Healthcare. The idea is to just revisit again very briefly the dangers of smoking. I know this may sound, very obvious, and this is something that we all know. And I've tried to quit smoking, it didn't work out, and please don't give me this same whatever. But, I honestly think it's so important. I was driving a couple of days ago and saw a gentleman who was middle-aged driving while smoking with two kids in the car, and it really broke my heart, literally. So I decided to have few more things about smoking. As you know, smoking increases the risk of all cancers with no exception. Respiratory problems, anything related to the lung and anything related to the lung will be affected. The heart, I'll talk about it briefly. You don't want to ask, everything related to the heart is negatively affected by smoking. Remarkable reduce in sexual abilities, drive, and fertility. Premature aging, it's so common to talk about these, all the oral health problems that you can imagine, including the smell, very weakened immune system, increased risk of diabetes, financial burden, secondhand smoking, and imagine third-hand smoking. So if you go to a hotel and they say we don't have non-smoking rooms and you stay there for a week, for a day, you are subjecting yourself to harm, believe it or not. Smoking is addictive, and I admit it, and that's something we need to admit. And obviously, nothing but our respect and love to all smokers. But just want to, add some encouragement to stop smoking and quit. The heart is markedly affected by smoking in every way: heart attack, hardening of blood vessels, weakening of the heart muscle, heart failure, etc. Huge epidemic of smoking. It's increasing. Now we have the electronic cigarette, which is another disaster, the shisha or ergila, and some other forms of smoking, in addition to the lethal killer tobacco smoking. The adolescents are markedly affected. The young population is being targeted. Please protect your kids and the community kids. Believe it or not, believe it or not, tobacco kills up to 1 in every 2 users globally. Shisha or water pipe or whatever you want to call it is a major killer. This is a study from France showing that 1 hour of shisha equals around 30 cigarettes. There's another study, 50 cigarettes, a study done in Memphis, Tennessee, in the States, 100 cigarettes. So this is a true epidemic, and this is something used in some other areas where it's called midwach. Again, a remarkably lethal form of smoking. Nicotine is addictive, no question about it. It affects some receptors in the brain. Yes, it's psychological addiction, but it's quite significant, and it has a stimulant effect that makes people smoke and again smoke and smoke. I've seen patients in the 30s, 40s with diffuse heart disease, especially if they are diabetic, but they don't have to be diabetic. Smoking makes the blood vessels sticky, makes the platelet and the blood very sticky. Smoking can cause hardening of the blood vessels. Smoking can induce diabetes and even affect cholesterol in a very negative effect. Smoking has carbon monoxide and very bad things related to the blood. Smoking is literally heart disease. As I said before, briefly, smoking affects our sexual abilities, at least as men, and causes impotence. Please remember the second-hand smoking, and very importantly, what I said initially, the third-hand smoking. You know about all of this. There are label warning about stopping smoking. I understand. I wanted to add a small pebble in the mountain of smoking cessation. I hope that this was helpful. It's a gentle, polite, caring, compassionate reminder that smoking is very harmful. It affects our health in so many ways, and it is possible, logical, and prudent and wise to stop smoking and quit now. Thank you so much. With 90 Seconds Healthcare, have a great day.